Hello and welcome to Afternoons with Allie. Thank you for joining me, and I appreciate the viewers who tuned into my first show. Today we are going to be talking about a very important topic, what we as young people need to know about during COVID-19, just as we're surpassing record daily totals of new infections. There were over 250,000 new cases per day and 4,000 deaths per day yesterday. I will also be interviewing a lung specialist who has been treating patients at Mayo Clinic. Also, I'll be talking about how we can help frontline workers in our communities, and I will also share some inspiring stories of creativity for a cause during this crisis. Even though we were planning on focusing this episode on the important information we need to know about living through this pandemic, I feel I have to also talk about the historic and terrifying events that have occurred in Washington, D.C. this week as a mob of angry Trump supporters stormed into the Capitol building in an effort to stop the Congress from confirming the votes by state electors for this presidency. This was very scary to me and other people as well. After Democrats won by a majority in the Senate for the Tuesday runoff elections in Georgia on Wednesday, large crowds of thousands of supporters of President Trump gathered to hear him speak and to protest the election results. While the Senate and House of Representatives met in Washington, D.C. to confirm the votes of electors chosen by states, Donald Trump gave a speech that continued to anger the crowd by repeating false and disproven accusations that the November 3rd election of Joe Biden was a result of a widespread fraud. He then proclaimed his Vice President Mike Pence had the power to reject results of the election and send the votes back to the states so they could change their minds. Despite his claims, the vice president does not have this power, or every vice president would choose to re-elect the president they've been serving. The president told the crowd to march on the Capitol and protest the confirmation of the results, and the angry crowd overwhelmed the Capitol Police and other law enforcement, assaulting them and spraying them with pepper spray. Crowds streamed into the Capitol, our center of democracy, in a historic effort to stop the democratic process. By the end of this event, more than 50 members of law enforcement were injured and 4 people died, including a 35-year-old woman who had stormed into the building as part of the crowd. This tragic time is one that our generation will remember as demonstrating the power of words to influence people and of social media spread falsehoods and extreme points of view. While all of this was happening, we were facing record numbers of new COVID-19 infections, as I mentioned before. I want to make sure we as kids know everything we need to know about keeping ourselves and others safe. I would like to welcome our guest, Kate Walsh, PA, who has worked in the field of pulmonary medicine or lung medicine for over 10 years. She has presented her patient cases to doctors all over the Mayo Clinic system because of her success in helping patients with COVID avoid having to go to the hospital. On a personal note, she saved my mom's life during her fight with cancer. Welcome, Miss Kate.
Thanks, Allie. Thanks for having me.
My first question is, how does COVID compare to other infectious diseases you've witnessed in the past, like flu, H1N1, or other lung diseases?
Good question. So, from what I'm seeing with COVID is it seems to be much more infectious, meaning it can be transmitted easier from person to person. We don't have nearly as many cases of flu as COVID as in the hospital, as well as outpatient setting. Our numbers actually are very high right now, and we don't see numbers like this with flu. So that's one difference. It can lead to respiratory failure and it can lead to those conditions in people with comorbid conditions. So people that have asthma that are young can get very ill. So even though you're young, you can't escape COVID for some people, or it can affect people that are older as well. So it unfortunately preys on our vulnerable population, I would say.
What do you think kids should know about the way COVID spreads?
Good question. So COVID can be spread by multiple different mechanisms. So it can be spread via respiratory droplets in the air. So there's a lot of controversy about what to do to prevent COVID spread. So one thing that I recommend is I go by the CDC guidelines. So the CDC is the Center for Disease Control, and we go by their recommendations. And their recommendations include frequent hand washing. Hand washing, you have to do appropriate technique and timing, which is also difficult. So you have to wash more than 20 seconds, and you can use hand sanitizer and you can use soap. You also need to socially distance, so remaining 6 feet from individuals. And since there's kids watching this, I would say that's actually very hard for kids to do. I have 2 boys, so I know it's very hard for them to stay 6 feet away from somebody. I think people don't realize how far 6 feet really is, but it really is a good distance away from somebody. And you should wear masks. So I think one thing that gets confused is that you need to do all those things. So even if you're wearing a mask, you should still social distance from somebody, because masks are not 100%. Hand washing is not 100%. These are all behavioral changes, and behavioral changes are not 100%. So we need to do them all collectively in order to prevent the spread of it. And all are equally as important as well. So hand washing is important, mask wearing is important, and socially distancing yourself from others is important.
Wow. What are the most common symptoms for COVID?
There's a lot of different symptoms for COVID. So some people have the GI manifestations. So they get nausea, they get vomiting, they get abdominal pain. I've had some patients that just had back pain. That's the only symptom that they had, was back pain. There's some patients that get eye changes, and that's the only symptom that they get. So the most common symptoms, though, are fever, cough, chest congestion, shortness of breath, those upper respiratory tract type infections. Those are your most common symptoms associated with COVID.
Well, thank you. What are the best way for kids to protect ourselves in school and other public places?
So it's doing all those things that we talked about that the CDC recommends. So in school, I know it's hard to socially distance because it's crowded. So when you can't be 6 feet from each other, wearing your mask and being diligent about wearing your masks. Also using masks appropriately. So don't play with your mask, don't put your mask in your mouth. If your mask gets wet, it becomes ineffective. So I've had kids suck on their masks and the front part of it gets wet. So it's things like that that you should be precautious of. So using your mask properly is really important. And then washing your hands as well. So one thing I will say is kids' hands get dirty. So if you're going to use hand sanitizer, then that dirt and that grime that's on your hand prevents that hand sanitizer from working. So you want to wash your hands with soap, keep your hands clean as possible, and then use the hand sanitizer between the times that you get to and from the bathroom to wash your hands. And you should wash your hands before you eat and after you eat. Before you use the restroom, after you use the restroom. Anytime you touch your face, you should wash your hands. So it's really frequently that you're going to be washing your hands.
Now, why should we wear masks? I've heard people say that the virus is very small. How do masks help prevent the spread of COVID?
So masks are important, actually. So I know there's a lot of controversy about masks and whether or not mask wearing helps or doesn't help. But what we have found is it is helpful. One thing about masks is you have to get the appropriate mask. So my boys all want to wear gaiters. Gaiters are fun masks, but they really don't work. They're ineffective because they're one layer. So you want a mask that has multiple layers, that's breathable and washable. So those are key features with a mask. The masks prevent you inhaling aerosolized droplets from somebody else coughing or somebody else sneezing, and it prevents you from passing those droplets onto other people. So the N95 masks that everybody heard about, they're good, but they're good in certain settings. So if you're doing direct care, if you're going into a patient's room regularly, you need those masks because you're going to be really close with that patient, and that patient likely, if they're in the hospital, is symptomatic. So they are coughing, they're sneezing, they're putting a lot of droplets into the air. One thing that that person can do to protect the other person is maintain those droplets close to them by putting a mask on. So masks are important for not only the person wearing them to prevent spread, but also people around them to prevent them picking it up from the people that are infected.
Good to know. If we find out how contracted COVID, what should our parents do to help us stay healthy as possible?
Yeah, kids typically have more mild and quick illness, which is good for you to know. And they don't typically spread it as easily because their symptomatic time is much shorter. So one thing that you can do though is to keep other people safe is follow the recommendations. And I was going to tell you about some of those recommendations. So when we have somebody that's positive and they're having some symptoms, we have to go over the difference between quarantine and self-isolation. Do you know the difference, Allie, between quarantine and self-isolation?
No.
No. So quarantining is if you've been exposed to somebody and you need to stay at home. Okay. Self-isolation is if you have COVID, you need to have a bedroom to yourself and a bathroom to yourself if possible. And you need to stay in that environment until your symptoms are improving. So you've been fever-free for 24 hours and it's been 10 days since your symptoms first started. Okay. People that have lower immune systems, that changes to 20 days or more. So it can be a long time to be in a room. It's not fun. And then the quarantining is when people are able to finally leave their home. So they can leave their home because that risk of exposure, they haven't developed symptoms, they're 7 days out and have tested negative, or 10 days out and have no symptoms. People can develop symptoms up to 14 days from exposure. Do you know what exposure is?
I do not.
No. So exposure is another good thing to be aware of because what classifies as exposure is somebody that's been around somebody with COVID that tested positive within 3 to 5 days and have been within 6 feet of them for more than 15 minutes and not had masks on. So a lot of people kind of freak out a little bit saying, oh, I was around this person and they had COVID, but I've been in rooms with patients that tested positive after, but we both were wearing masks and we were socially distanced, so I didn't get COVID because of that. So using those precautions and those guidelines did help prevent me from getting COVID from other people having it.
Thank you for that information.
Yeah.
Will the kids
I was going to add, Allie, another thing too is you need to take good care of yourself so that your parents don't have to. So you need to get plenty of rest, drink plenty of fluids, and not only fluids like water, but I'm sure you've had Pedialyte before. A lot of people with COVID have fevers and have lots of sweating. So you want to get water as well as an electrolyte to kind of balance that fluid balance in your body. So getting plenty of rest, getting that fluid intake is important. You can take Mucinex, something like that, to loosen the mucus if you're having trouble with mucus secretions. You can also go outside. So don't go out on a walk or anything, but you can sit in your backyard if you're not around anybody and nobody's back there with you. It's important to get some fresh air and some sunlight. Sunlight can get your vitamin D levels up, and it can help you feel better mentally and physically. So you don't have to necessarily stay locked in a room. You can put on your mask, stay socially distanced, walk out, stay outside, walk around your backyard a little bit, and still get some activity.
The next question I was going to ask is, will the kids receive the vaccine?
I think eventually they will. Once we reach our more high-risk population, I think they're going to start looking and getting it approved for a lower age demographic. So down the road, I think definitely the vaccine will be available to children, especially because children do have other risk factors. There are children with asthma. There are children that are unfortunately battling things like cancer. So there are children that definitely could benefit from this vaccination. and they will eventually get it, I think.
Good to know. Finally, once we are vaccinated, should we still socially distance and wear our masks?
So that's a very good question. So recommendations currently are to do that. So until we have a substantial decrease in the amount of COVID that we're seeing, it's still better to be precautious. The vaccines, some of them are above 90% effective, but there's still an area for error in there. There's still a chance that you could potentially get it, even though the chance is extremely low, and you want to protect others. So the whole goal of using masks and social distance is not only protecting you, but protecting others. So I think we'll still be protecting others as long as there's a high level of COVID in our environment.
Well, thank you so much for joining us. I've really enjoyed our time with you.
Thank you, Allie. Thanks for having me.
Well, have a wonderful week.
You too.
Wow, thank you for all that information. It was lovely to have you on my show. If you would like to help other first responders, make sure you socially distance and wear a mask. Avoid going out whenever you can. Also, you can make cards and laminate them so that you can send them to healthcare workers on the front lines. Sending food or gift cards are also nice ways to treat people who have worked so hard to keep us safe, including our grocery store and pharmacy workers, as well as people serving in hospitals and doctors' offices. Finally, now for a little good news. A grad school student in Philadelphia, Pennsylvania, named Ben Berman, decided to raise money for a charity by making pizza and dropping it out his window with a pulley system to people down below, overall making $30,000 so far for the homeless and food insecure. Emily Jacobson, a young teacher, and many others who some are TikTok dancers and artists, came together and created Ratatouille, the musical, in order to raise money for the Actors Fund. Famous Broadway stars and directors came together to develop and produce a digital musical that was created by people on TikTok. The tickets for this digital show were sold at for a charity, and they made over $1 million selling tickets online. Thanks for everyone still tuning in. Thank you so much, and I hope to see you next week.